I'm from the Experience and Partnership team, and I work very closely with Steve, who I think you know. Lucy, would you like to quickly come on and just introduce yourself as the second speaker today?
Yeah, absolutely. Hello, everyone. I'm Lucy O'Reilly. I work at Barnados. I'm a youth voice consultant as a freelancer and done lots of work in youth health participation over the years, and a lived experience person as well. And I'll be talking today around young carers and our youth voice programs that we support in Barnados.
Thank you so much, Lucy. So just in the agenda today, we're going to hear from me for a little while, and we're going to do a review of the bi-monthly webinars. I think you've been sent a survey link, which I've looked into, and we've got the analysis of that. I'll be showing that today. We will also be discussing the terms of reference that I sent out as well. We're going to do that relatively speedily, just to give a good amount of space for Lucy to talk about NHS Young Person's Health Challenge, which I believe Lucy still works with 7 to 14-year-old young people. So I'm looking forward to hearing about that as well. So shall we just go straight into the review? If we can, Steve. Brilliant. So I'm just going to get there we go. Okay, so we're reviewing this lunch and learn, and I said we're going to talk about the terms of reference. And there were 6 questions that I posted in the survey about what you find beneficial, what lets you more or less off, how can you make this better, correct frequency, alternative suggestions to name the group, or any additional thoughts. If you have the next slide, please, Steve. Brilliant. So we're going to look at the tour. I don't mean to teach people to suck eggs, but I thought it was important, as it's an acronym, just to give a little bit about what a tour does. It basically defines the objectives, the purpose, the membership, the structure of a meeting, and it talks about how the group's defined and developed. So if we go to the next slide, please. Steve. Thank you. So we put together a tour. If you have anything to say about that tour, anything you'd like to see change, please post that in the comments box now, rather than me go through a long list, because we've got quite a small amount of time here. So obviously, one of the first things with the tour was that we have an informal atmosphere, and that we collaborate and share learning. Now, one of the things I've done there is added and carers' stories, because that was something that came through very, very strongly in the survey that we put out. We talked about driving the identification and support for unpaid carers, about knowledge share between everybody in this group and unpaid carers around strategy, policy, and carers program of work. Act as a route to support NHS form policy. So we know we've got the long-term plan submission underway at the moment through the NHS Change portal, where individuals or organisations can submit information they'd like to see included in the long-term plan or any ideas. So that's one example of where this group feeds into national policy. To help us support national initiatives like Carers Week, for example, to feed into how we might form that, to feed information from this group to governance structures, to NHS England government structures and the Carers Partnerships Board, and to build awareness of innovation in the carers world via external speakers. So if you've got any comments on that tour, anything you'd like to see added or changed, please add them in the comments box now. And I'll give you around 20 seconds to do that, just to give me the chance to cut and paste that out and put that into the information capture template I've got. So has anybody got anything else to say about the tour? Or have we done a jolly good job? Okay. We don't seem to be having anything coming in about the tour at the moment, which is great. Now, what we will do with that tour is that we would then review that on an annual basis. So after this meeting, Steve and I will talk about doing this again in about November next year, just to make it fit for purpose for what the group is and does. So if we could have the next slide, please, Steve. Okay, we've got the next slide, Steve. Brilliant. The other thing we covered in the tour, sorry, was the yeah, the next one, please, Steve. That's it. Was the membership. So membership consists of unpaid carers, primary care, secondary care, local government and voluntary community sector enterprises, and VCSE, that's it, VCSE sector representatives. And the frequency was bi-monthly and for 1 hour. Now, the recent Lunch and Learn survey gave 100% agreement with the frequency of the meeting. So unless that anybody else has got anything to say in terms of frequency, via the comments box, with that 100% agreement, I think it's probably right that we stick to the frequency bi-monthly. Unless anybody's got anything to say, I'll keep an eye on the comments box. If not, so can we have the next slide, please, Steve? Okay. So then we talked about via the survey, what do we find beneficial from the group? And there was a lot that came through. Peer support, shared learning experiencing, networking groups, carers, best practice examples, information and knowledge, insights about carers and carer support. And then I had another one came through yesterday, everything is relative and targeted information. Some of the things that sort of hit home to me as I was pulling together the information in this survey, I've put in blue in little comments, sort of icons on the right-hand side. Stories from the group which I can relate to, which makes me feel less alone and more seen, and finding about different groups' achievements across the caring sector. So if you've got anything else that you find beneficial from the group, please, again, post that in the comments box. Is there anything else you would like to say? It's a quiet old comments box today. Yeah, brilliant. Thanks for popping that in, Steve. Next slide, please. So what would you like to see more or less of? Themes of more of. We didn't really have any less of. But see, a really strong theme that came through is sharing of support and individual carer stories. And a couple of people in the survey said that. Informational practical support for carers, a wider a broader range of carers and who they care for, impact of legislative changes. There was one comment that came through about the 600 carers that also work for the NHS England, whether we can involve them. New carer-led projects instead of system-led, and a need for a mixture of regional and national change. And then there in the comments box, more stuff about young adult carers. So again, this group of 41 people that are here today, have you got anything you'd like to see more or less of during these meetings? Please do feel free to put your hand up and speak as well if you don't want to use the comments box. Okie dokie. And the next slide, please, Steve. So the next thing we're going to talk about, I think, is how we make this group better. So, you struggling with that slide, Steve, or you got it? You got
Jim,
it. Thank you.
We had a hand up.
Sorry, I missed that. Who was that?
Was it? I think it was Lorna. Was it Lorna Carter? I think.
Did you have your hand up, Lorna?
Yeah, I did. Yeah, it was only just a quick comment, really. With my role, I work obviously in Gloucestershire, so I work between the acute trust, the community hospitals in the county. But I think what we do miss a lot is working carers, because the amount of staff that are in the trust that are actually working carers that aren't registered with the trust and getting the support they need, and obviously with the carers leave act as well that's in place now, that was passed in April. I do think with, like I said, with all the presentations and the work that I do, the majority of people that come up to me after a meeting to say, well, actually, I'm a carer, I didn't realise, and these are actually top people, and even directors actually within our county that have said I'm carers. So it's just something from my aspect. I just think that we need to be thinking about working carers as well, because we do really tend to miss that option, because everybody thinks that somebody is a carer. you know, can't work as well. And again, people can do that with the right support. So that was just something I just really wanted to add, if that's okay.
That's great, Lorna. Thank you so
Thank
much.
you.
We're lucky enough to have Todd Cockman here today, who has got his hand up. So, Todd, would you like to come in? Probably on working carers.
Yeah, it is on working carers. Thanks, Lorna, for sort of introducing that. So I help run the NHSE staff carers network, and there are around 600 of us, although that's probably an underrepresentation given that the staff survey results show that probably 1 in 3 people in the NHS are also combining work with care. So if you multiply that up by headcount, that's probably 500,000 in the country. So there's an awful lot of carers around that do need support. And I'd also welcome that sort of more inward-looking aspect if the forum could incorporate that too. So yeah, definitely endorse what Lorna said. Thank you.
Yeah, and again, if any input, you know, please, I'm more than happy to support anything, because, you know, I just think the crucial role that these staff play on top of everything else and things like that. So, you know, and actually trying to keep those working carers within the trust, because the amount of money that you must input to your staff to train them up, and then the reason they leave is because then there's no flexible working, and we're not thinking about that carer. But if we actually thought a little bit outside the box, you're actually going to be saving the trust a lot of money. So, you know, just from my experience, so if I can help in any way, please do contact me. But as you can probably tell in my tone of my voice, it's something that I'm really passionate about, you know, since I've been doing this job, and the vital role, you know, that unpaid carers do within the trust.
Thank you, Lorna. I've made sure I've included that in the findings today, and Todd's comment as well. Thank you to Jessica and Pamela, who've popped some stuff in the comments box. Yep, brilliant. Well, we'll move on to how can we make this group better. We're on quite a tight time schedule today, so I'm going to have to crack us through. Themes included, making it easy to find the recording if I missed it. Quite a few people said they're really happy with the way it's currently run. There were suggestions of small group engagement breakout sessions, more sharing and less being talked to, and I'm sorry about how much I'm talking today. Follow-up bulletin with links to sessions and further reading, maybe every 6 weeks. But we might think about doing that through an email rather than a bulletin. Inviting more residents of our communities to attend, more speakers from Alzheimer's UK or equivalent organisations or charities. We're lucky to have Barnados here today, and aligned topics with ICB delivery sessions. There's one here about aimed at staff or unpaid carers or both, but I think we've covered that with, you know, Todd saying today that, you know, these sessions are also for working carers. And there we go, explain how this group links with the carers network. Todd Cockman's networks, what the difference? Well, Todd's is very focused on carers working within the NHS, which is a much broader network based on the tour that we discussed earlier. So have we got any comments on how can we make this group better? And please, as I say, post them in the comments box or pop your hand up. Okay, I think the server did a pretty good job at capturing stuff beforehand. Okie doke. So just the last slide, please, Steve, and I think I'll be finished by your deadline, Steve. So the last slide is final bits and bobs around the survey that we put out. So the frequency of the group, I've covered that already. There were 10 responses that said yes, the frequency is great. Alternative sessions to the name into the group. We had ones that said, what's wrong with lunch and learn? So there we go. Any additional thoughts? Some people felt that it feels a bit random at points, and that's almost why we're putting the tour together today and looking at the tour to make sure it's a good meeting for every audience, for every person that's here. You know, if you hope to reach unpaid carers, how do you reach them and encourage them to participate? I think that's something that Steve and I are going to have a think about. Would it be helpful to encourage local support groups like the charity I work for? We've got them in the terms of reference. that they are part of this membership. So again, Steve and I can go away and think about how we might get more charities here. I think hopefully the tour has picked up on that comment. What do we do differently to the Carers Network? I'm not quite sure what that one means. I've been to both sessions, 2 sessions. They've been useful. Something that came through was the informal nature of this meeting, and actually for carers it's quite helpful to do over a lunch period, so that came through. And then another carers comment: I've enjoyed these sessions as a carers and it's important to see. So has anybody else got anything to come along? I think Todd's got a comment about Westminster Carers Day reception, so he's hoping to see people there. So if you've got any more comments about that, about the looking at the terms of reference and the review of findings from the survey, please do pop them in the comments box. What we'll do with this is Steve and I will go away and have a look at the findings of today, and also the survey review, and then hopefully in a couple of weeks we'll come back and sort of do a bit of a "you said we did" piece where we sort of say how we responded to that, and then this meeting will carry forward. So thank you so much for your time today, and for everybody that contributed to the survey. I was really impressed actually by the feedback we got through that survey. And now I'm hoping to pass over to Luci Riley. Absolutely fascinated to hear about this programme. I've got good knowledge of this programme, I think, over the last 4 years. So I'm really excited to hear about how it's developed. And over to you, Luci. And very good luck with the animation you're trying to say, Luci. I know that feeling.
Thanks, Jim. Hello, everyone. As I say, I'm Luci. I work at Barnados Voice and Influence team. I will share the relevant screen for you, so
I'll stop sharing, Lucy, so you can.
Oh, thank you so much.
There you go.
Oh, fantastic, you're a star. And I should be able to present from here. And now I won't be able to see anyone, but yeah, thank you so much for having me today. It's a real privilege, and thank you for spending the time with us. I hope you're snuggled up with some soup, listening to this chat as well. I think that's why I really like lunch and learns. So just a bit of like context setting, I suppose, and why we're here. And my colleague Daisy West is also on the call, and I'll hand over to her as well to talk more about the NHS Youth Forum and the Youth Advisory Group. But we're kind of focusing around like that voice and influence piece today in health. But generally speaking, so Barnados, as you know, is a huge organisation that works with babies, children, young people, young adults and their families. The voice and influence team are there to ensure that the voices of all those people are embedded within the organisation, and the decisions that affect them. And then as part of the voice and influence team, we have a health kind of sub-team, which myself and Daisy and Bronte and Rachel, as you know, Jim, work in. So we work directly with on various kind of projects to ensure that young people are heard and help shape the decisions that affect them in the NHS. So one of those projects is the Young People's Health Challenge, so something we've developed in partnership with the Royal College of Paediatrics and Child Health and NHS England. We run the NHS the Youth Forum and the Youth Advisory Network, and we also are supporting the Children and Young People's Health Equity Collaborative. We've got around 10 young people champions who are involved in that collaborative as well. So yeah, lots going on. The
NHS is something that
I feel like I need to test whether the sound works before I do that. Can you hear that okay? Is it also sharing my sound?
Yeah.
It was.
Yeah?
We had it, Lucy.
It was.
Yeah,
that's fine. I've just paused it. So I'm going to like introduce the Young People's Health Challenge. We had a wonderful animator. I'm from Bristol as well, so I'm always really excited when I see any clay animation. We worked with an animator on this video, and we really love it. So great to share it with you.
touches everybody's life here in the UK. But how much do we really know about it? The NHS Young People's Health Challenge is here to shine a light on our National Health Service, and we want you to get involved. We have a whole rainbow of creative fun challenges that you can take part in, such as using creativity to get your message heard, exploring nature, becoming active and looking after yourself, celebrating the NHS and connecting with your community. And by completing the challenges, you learn all about the NHS and how to support it, as well as discovering about health and well-being. The NHS Young People's Health Challenge. Get involved.
Just a good bit of fun there, I think.
The
No, hang on, let's not play again. So, I mean, that gives you a bit of a fun, broad overview. But as Jim was saying, so a few years ago, we were approached by NHS England to collaborate to create the programme. We've been working, actually, I think that number's wrong. It's more like 500 young people. And then additionally within this project, more young people to co-create the programme. So the activities, the topics, how it looks, how it feels, how it's delivered. So it's a really great example of co-production. We worked with children and young people to understand like what was the aim from NHS England, etc. So it comes, as far as I'm aware, and this is kind of before my time, I've started the job in February. It's the kind of package that we came from was actually in the system. We understand that there are lots of things that young people can take part in, but they don't necessarily know much about the NHS. And there are lots of programs and activities that young people can do, but often the engagement happens kind of in that beyond 14 age bracket. So the program that has been delivered with under 7s and over 14s, but is mainly targeted towards that 7 to 14 age bracket. So it's aiming to help children and young people learn about the NHS, how they can help the NHS, and how they look after their own health. And generally, like, ignore that one generic thing, but we do want to know what your thoughts are as well, but we'll go back to that at the end. So a little bit of an overview for you there. Yes, it's for 7 to 14. It's pretty much like deliverable in so many different places, and that's exactly what I've been working on. And it has a number of benefits for local organisations, NHS trusts, etc. And as well as short term, yes, young people have taken part in these challenges and learned something. We're also envisaging that there would be lots of long-term benefits. So what young people gain by taking part. So they learn about their health and well-being, they understand how they support their own and others' well-being, discover how everyday actions can help the NHS, how they can give back to the NHS, exploring careers and jobs in the NHS, and taking action to support the NHS. I've said the NHS a lot in that thing. So it's no surprise why I'm wearing a rainbow. It's because in some of the designing, it came about that actually a rainbow would be really fun. So that's how we've got 7 different topics, 7 different colours. So it nicely works out quite well in terms of marketing. We've developed a range of guidance to go with the resources and toolkits. There are 3 toolkits. So I like to think of them as stages rather than ages, because actually our delivery leads have been doing a bit of a mixture of everything. But the original kind of intention, and I like to describe it as a bit of a Nando's chili situation. So get interested is your introductory 1 chili, get involved is 2 chilies, and get leading is 3 chilies. Get leading is more focused on that kind of older age bracket, but those young people who know more about the NHS, how they look after themselves, and are more thinking about that social action group work. And how they can do things in their local area. So it's just slightly more challenging. But we have had young people do a range, do the whole thing. There are 21 challenges to choose from in each book, so 63 in total. I think that's the right math. And not all the challenges are different. So there's kind of different stages of the same challenge as well in there. And so young people earn certificates as part of their taking part. So anyone who takes part gets a certificate for taking part. They get a colour award if they complete 3 or more of the same colour. And if they do a range of colours, they get a rainbow award, unsurprisingly. So I thought I'd talk to you a little bit about like what the challenge has meant in action, what's actually been happening. So I've been in post since February time, and we've been mainly focusing on how we can deliver. So we've piloted the programme. We know it works, we know young people like it, but actually how could we sustainably deliver the programme in local areas? And I'm not going to lie, it's been a bit of a challenge in lots of different ways. There's been kind of a real mixture of not necessarily lack of enthusiasm, because there's a great deal of enthusiasm for this really great program, but actually thinking about how it can be delivered, the resource, the capacity. We've come across, quite a few kind of unexpected challenges, really. The initial idea was working with ICB leads to roll out within their own area, but actually that wasn't necessarily the right way to go. And we've actually opened up, we opened up sort of sign up and interest in February, March time to anyone essentially who wanted to take part. So any young person can take part, any young people's group can take part. So as you can imagine, my job is quite varied in that I could be talking to someone from Dorset and talking to someone from Greater Manchester, London, in one day. So it's a really hard one to kind of map out. But because anyone can take part, we've kind of tried to target it a little bit here and there. But we're working with lots of groups across England. So we kind of have refocused on our work to be like, actually, where works really well, what's going well, and how can we reach the most young people, but also like what's interesting for young people. So we've captured lots of that stuff. We're currently capturing kind of data from those who have delivered. These are just some examples of the people who've delivered kind of in the last few months. So we've been working very closely with our delivery leads to understand how is it beneficial for them? How can we, if they're not connected, connecting them with their ICB so that there can be some long-term engagement and connection there. And really thinking about like how can it benefit the young people that they're involved in. So from a young carers perspective, like we don't have the data yet on who of those young people that have delivered and been part of the activities as to whether they're a young carer, but we have tried to target certain groups that are seldom heard in order to ensure that we're kind of representing that basis. We have worked with a group of young carers in the Black Country where we've done a bit more targeted work. So just to give you an example of how it's worked in practice. So we've been working with hospital youth forums where we've got young people who are kind of that 11 to 16 age bracket, using the toolkit and activities as a kind of intro and basics to the NHS and how it works a little bit, and helping develop their confidence and skills to be able to kind of do that role as a representative in a youth forum. Dorset Hospitals, we've got a great team who are wanting to kind of outreach, engage with the community, and kind of from that voice perspective, be like using the activities as a tool to really engage with these groups, to start those conversations, to then ensure that we can reach young people who are using the services within the county. So they're delivering with a group of sea cadets, with their children's hospital school, which is really nice. So young people are taking part whilst they're in hospital. So that's been a really good project. We're working with Greater Manchester Healthy Schools. So what they've called the big Healthy Schools Challenge. So we've got 35 pupils from 15 schools in Greater Manchester who are essentially training to be health champions. So the activities form part of their journey, and they will then deliver a campaign or project in their own school with kind of other young people every term. So that's going on until obviously the end of this academic year, and then we're working with a SEND school who they've got an independent living skills group who we've been delivering with. So just an example of kind of how it's worked. For those who haven't delivered yet, I think what the main learning we've got so far is that like people need more time. And it's not that we need time because it's a kind of ready to go program, but actually thinking about those steps for making it meaningful for young people. How can we deliver really well, choosing the activities that suit that group, coming from a basis of like choice and voice and wanting young people to be able to shape that. So there's lots of opportunities for young people to kind of really shape what that is. I feel like, you know, all the things you wanted to say, you're like, did this cover what I wanted to say? But yes, that's me. So we've been working on this for the previous 9 months. I'm actually leaving this role and the contract next week. So it's kind of a bit like we're at the end of stuff, but it's almost like we are at the beginning. There's kind of so much more to come. I'm really excited about the programme. So I'm going to hand over to Daisy, if she is there, to talk about the NHS Youth Forum and the work that we've been doing and the Youth Advisory Network. So you let me know when you want to change slides.
Thank you so much, Lucy. Yeah, all of the work that she's been doing has been absolutely incredible. But hi, I'm Daisy West. I work I'm a Voice and Influence project worker for the NHS England Youth Forum and Youth Advisory Network. So we work with Luci within Barnados Voice and Influence, but we hold the NHS England Youth Forum and Youth Advisory Network. We only began holding it this year, so that's a role that I only started in January and having a lot of fun with it. So I'll tell you a bit of background about the Youth Forum and the Youth Advisory Network. So first up is the NHS England Youth Forum. It's been around, I think this is the 10th year that it's been around, but it's the first year under our watchful eye. And so the Youth Forum is made up of 25 young people from all over the country, aged 16 to 24, and it offers a space to share feedback, thoughts and ideas on the changes young people want to see within NHS England and the wider health services. So what that means for the Youth Forum is that they are working on 4 research projects at the moment, and they're kind of split into these subgroups, and the topics of them are based on the things that they wanted to see and work on, as well as things that the NHS England policy were like interested teams that wanted us to get involved as well. So it's been a nice sort of merging of a lot of things, and the topics that we're focusing on are NHS workforce, mental health, transitional care and new hospitals. And the research projects that we've been doing from the start up until now are completely like youth-led. So Bronte, who's the project lead, and I have sort of offered like scaffolding really for the projects. We set up the spaces, we send out the invites, but the young people do the work really. So they created surveys on these 4 topics and sent them out. They were open for about a month, I think, and overall we received over 500 responses, which is really incredible. And all of the questions, all of everything were created by the young people and for young people. And some of the survey groups, they decided actually, so the new hospitals one, they decided actually they wanted it to be for anyone to respond, so not just young people. But mental health wanted it to be only up to 24-year-olds, and transitional care up to 30-year-olds, I believe. So each group has sort of been led by their own desires and interests and stuff. It's a really diverse group of young people. There are 2 young carers in the group who sort of identified as young carers themselves. And yeah, so they've been working with NHS policy teams to co-produce surveys. And we recently had a residential, which was a really great opportunity to work together face to face and actually meet everyone face to face. A lot of it is online. And we did some stuff on like data analysis, as well as workshops about NHS careers, health inequalities that Lucy ran, and a workshop on SEND and learning disabilities and how we can like be more mindful of supporting young people with learning disabilities to get involved with youth voice opportunities. And then the Youth Forum have also been involved with public speaking things such as the Barnados Leadership Conference, and like social media content, and just a load of other stuff. And it's a year-long program. So we've got our 2024 cohort, and next year we'll be recruiting for the 2025 cohort, and that'll be 25 young people as well. But we really want to think about how we'll get the opportunity out to more young people from all different backgrounds, and encourage young carers as well, especially, to get involved. Lucy, could you change the slides, please? Thank you. And then, sorry, I appreciate it's a lot of information I'm just throwing at you. And then we've got the Youth Advisory Network that we also hold. They're a little confusing because they are really similar names, but quite different groups. But a lot of the youth forum members kind of fall under the advisory network. And so what this is, the advisory network, is a group of over 70 young people who are aged 11 to 25. So it's a really broad range of young people, all from across England, all from different areas, different backgrounds, everything like that. We've got 9 young carers in the Youth Advisory Network. And yeah, so what this group does, this group gives young people the chance to have their voices heard and input on key health issues with a smaller time commitment than the Youth Forum. So while the Youth Forum will have 2 monthly meetings, and a lot of that will be kind of group work on their own and things, the Youth Advisory Network will be a monthly consultation with NHS services, as well as like signposting or creating other opportunities for them. And so some of the monthly consultations that we've had with the group have been things like urgent and emergency care, mental health in schools, NHS workforce, children's health and climate change, social prescribing, and loads others. And it's all just sort of that comes through, and we set it up with the NHS services or policy or whoever, and then like run that session. So there's been around like 30 to 40 young people attend those sessions, and we've done a couple of like focus groups and smaller group work as well. And like it says, we've also signposted to other opportunities to shape decision making in the NHS. So a few of our young people are involved with the NHS Citizens Advisory Group. And I believe we sort of signposted to a young carers opportunity through Steam as well. And so a couple of we sort of sent that out to everyone that might be interested in getting involved with an opportunity through that. And then we also ran a Young People's Health Challenge piece with our young people, because we really wanted to focus on how we support our young people aged 11 to 14, because it can be quite an intense space with it being 11 to 25-year-olds, and we wanted to make sure that we were like really supporting their skill development and growth and things. So yeah, it was a really fun opportunity, and also as well as exploring how we could like run it online as well. Sorry, that was a bit of a word dump.
Real whistle stop tour of all
Sorry.
doing. It's fantastic, and Daisy and Bronte, wonderful team that are really empowering and amplifying the voices of young people. Thank you so much, Daisy. I also thought I would mention that Barnados do support young carers on a national basis. So we have 16 services across the UK that support young carers. So if that's something that you want to explore, they are there. I spoke to a wonderful service in the Isle of Wight who are running lots of stuff, and just are doing brilliant work. So we are doing lots of work on the ground. Sorry, Jim, were you going to ask something?
No, I was just going to thank you both, and no apologies needed. Really enjoyed that, loads of information. And I think already we're responding to some of the thoughts around the survey we put out in terms of what this group does. And one of the ones that came through was young carers. So we've very quickly picked up on that today. It was great to hear about young carers' involvement at the forum and the advisory board, Daisy, and sort of those young people's positions of influence within NHS England. That's absolutely brilliant. And I know, Lucy, at the very beginning of when we looked at what Young Person's Health Challenge is and what it looks like, we reached out to a huge, diverse group of people, and young carers were involved in that. And that came out with the beautiful design of it all. And I think that there was some young carers feedback early on when we started doing it in terms of accessibility, that the Young Person's Health Challenge is a good, it's not face to face, it's something people can pick up around care and responsibilities. So I think there was that feedback there now. So have we got any, very quickly, we've got about 5 minutes left, have we got any questions for Daisy or Lucy, or any comments? So please do put your hand up if you would like to speak to Daisy or Lucy about any of the things they've talked about today.
There is a question, Jim, in the chat box regarding from Natalie, asking, would be interested to hear how you decide on how to recruit the young people.
Is that for the forum and the
for the
advisory
forum?
board,
Yeah,
I guess?
I think so. Yeah.
Yeah, Lucy,
Thank you
Daisy.
thank you for the question, Natalie. It's so when we did the recruitment in March, I think we like opened it in February and March for both the Youth Advisory Network and the Youth Forum, and we were really mindful that we wanted it to kind of go straight to young people, because a lot of times you get young people who are already involved with Youth Voice stuff and then immediately coming in, and sort of will continue to do those things. So we wanted to try and get it into young people's hands. We use social media quite a lot and kind of put out a lot of things on social media, as well as sending out to a lot of our different like stakeholders or partners within Barnados and then also through the NHS. But it's kind of a learning process. Like, we're sort of figuring out what we want to reach as many young people as possible, and we really want to reach young people who haven't been involved with any like youth voice things, and it's really it's one of those things we would welcome any and all types or ideas. So one thought we had perhaps in the future is if we could kind of do like service visits or area visits to kind of do a bit of an open call for recruitment. But yeah, so it's just sort of we get young people to fill in like a short form of like, what are you passionate about and what are you interested in looking at or being a part of, and if there's any like skill development things that they want to do. But for the most part, it was a really open recruitment. So a lot of young people might have signed up, like I think through like schools or through youth forums that they're already like local youth forums that they're already a part of. But yeah, I think it's a bit of a, there's not like a we will only do it through XYZ. We really want to explore all the different options. And I think social media was really useful this time, as well as all of our like partner networks and stuff. And yeah, so I hope that answers the question.
Yeah, and for the Youth Advisory Network, Daisy, obviously we're looking to recruit more young people for that in the next few months. What's the kind of like, what do people need to do to be part of that? And I guess again the same answer in terms of, we put out a call out for any young person to take part. We're usually really lucky and lots of people kind of like to share the things that we do. But can any young person take part in the Youth Advisory Network?
Yeah, literally any young person can take part as long as they are in, I mean, it's NHS England, so if they kind of live in England, that's basically the only thing. They just need to be between 11 and 25 and live in England. I think the only questions that we asked for that application form was, what are you interested in and what would you not like to talk about, or like what would you not be interested in, and any accessibility things. So it's just sort of an open call for like, if you're interested in us sending you opportunities and being part of things. So it's quite a wide network. I think we then got references from young people, but that could be family, that could be literally anyone, and we kind of just went through, and then obviously got parent or carer consent as well for those that are under 18, just to make sure that we're sort of protecting those younger members as well. But there is no requirement. I think the only requirement is be interested in what the advisory network is, I think, is the main requirement.
Thank you,
and that's kind of
Daisy.
it.
Yeah, thanks, Daisy.
Thank you.
There's in terms of one of your questions, how can we involve and hear from more young carers? There's some stuff in the comments box from Carla saying sending details to local carer services, offering gift vouchers or references for CVs as an incentive. I'd like to thank you all for coming here today, particularly Daisy and Lucy. Good luck with your future endeavours, Lucy. Brilliant presentation from both of you. Thoroughly enjoyed it. Thanks for coming along from all attendees, carers, those involved in carer services across the health system. Really appreciate you coming along. And then lastly, a great big thanks to Steve, who drives this meeting so beautifully on a bi-monthly basis. Thanks, Steve. Thanks for inviting me as well to be involved today. I hope you all have a great day. Thank you.
Thank you.
Cheers, guys. Thank you.
Thanks. Bye, everybody.
Thank you. Bye-bye.
Thanks.
I'll stay in for a few seconds, Steve. 2 more people left.